Hello, I'm Dr. Stalin Ramprakash. I am one of the pediatric hematologist, oncologist, and bone marrow transplant physician working in Aster CMI Hospital, Bangalore. Today, we'll talk about bone marrow transplant. What exactly is it? Why it is done? How it is done? And what are the long-term outlook with the bone marrow transplant? Bone marrow transplant is a medical procedure where you are replacing some diseased or damaged stem cells of the patient with the donor stem cells. What sort of conditions it is done? We use it for many different conditions, but most of these conditions are either life-threatening or life-limiting conditions. For example, childhood leukemia, which is not cured by normal chemotherapy, then bone marrow transplant is a curative option. Sometimes it may be the only curative option. And some genetic conditions like thalassemia and sickle cell disease, where the bone marrow transplant will cure the actual genetic condition. And there are also other conditions like metabolic disorders, which can be cured with bone marrow transplant. And there are conditions where the immune system is not working. So those conditions can be treated with bone marrow transplant. And there are multiple situations where majority of these conditions, if you don't do the bone marrow transplant, their long-term outcome is very, very poor. Many of them will not survive into the adulthood. And how it is done? So bone marrow transplant is a medical procedure. Many people think it is some kind of surgery. It is not. And what we do is we have to remove the patient's own bone marrow. So we will have to give some medications, a kind of medications we will normally use in cancer therapy to kill off the patient's own bone marrow. And then we will collect the stem cells from the donor and then give it to the patient. So the donors can be of three types. Either they are matched brother or sister, or they are unrelated donors, or it can be a half-matched parents or brothers or sisters. With the current technology, the outcomes have significantly improved for all these types of transplant. Best is the fully matched brother or sister's transplant. And one thing I have to tell here is there is no risk for the donor as compared to any other type of transplant. It is almost like donating blood. So the donor will come to no harm because of donating the bone marrow or stem cells. And in terms of outlook, it depends on the condition, underlying condition. So for example, for leukemia, if you do a transplant, the outcomes are somewhere around 50 to 70% survival. But you have to remember this, none of these patients would have survived without a transplant. For conditions like thalassemia and sickle cell disease, for matched sibling, long-term survival, disease-free survival is above 95%. And for haploidentical transplant, maybe above 80%, and matched unrelated donor, it will be above 90%. So it has come as a life-saving treatment and life-changing treatment for many of these serious life-threatening hematological disorders.